Thank you, everybody, for being here. I think I will get started. Um, Here I am. So, welcome, everybody, and thank you so much for joining us this special World Environment Day Roundtable, hosted by Physicians Association for Nutrition, PAN International. I'm Dr. Nanine Wyma, your moderator for today's session. I serve as the director at PAN International and PAN South Africa. PAN International is a global medical nonprofit organization dedicated to reducing diet-related deaths by promoting evidence-based healthy diets for both personal and planetary well-being. We're proud to hold permanent observer status at the United Nations Framework Convention for Climate Change, or UNFCCC. Our global network is a vibrant community of over 14,000 doctors, dietitians, health professionals, and students, with offices in 10 countries and projects spanning over 65. Today's conversation explores the urgent intersection of healthcare, diet, and environmental sustainability. We've brought together leaders in sustainable food systems, public health, and advocacy to share cross-sector perspectives on transforming systems for healthier people and healthier planet. The wicked problems we face with chronic disease and climate change demand urgent, collaborative, and multidisciplinary solutions. Our panelists, from their diverse backgrounds, will help us examine how we eat, how we care, and how we advocate so that we can all contribute to a more sustainable and equitable future. While the challenges are complex, we believe the opportunities for shared action are significant. While each speaker comes with a unique lens, this conversation is all about collaboration and making connections across disciplines to uncover insights, identify barriers, and highlight what is working. We hope that you enjoy this dynamic discussion. We've invited our speakers to share not only what they know, but also what they've seen in practice and how we can move forward together. Before we dive in, please introduce yourselves in the chat and tell us where you're tuning in from. We encourage engagement in the chat and for everybody to connect with one another. Feel free to ask your questions throughout the session. You can post them in the chat, and we will do our best to answer each and every one of them. Of course, this webinar is being recorded and will be freely available afterwards. So to kick things off, we have an exceptional lineup of expert panelists joining today. They bring a wealth of diverse perspectives spanning the fields of medicine, policy, academia, advocacy, and philanthropy. So let's see if I can pin everybody on our screens. So I will, how many people can I pin at the same time? Today, I've just brief introduction of our panelists, starting off with Dr. Shireen Kassam, consultant hematologist and the founder of Plant-Based Health Professionals UK. Then we have Celine Kraus, medical student and member of the International Federation of Medical Students Associations, IFMSA, and National Climate Delegate of Estonia. We have Dawn Moncrief, the founding director of A Well-Fed World. Dr. Sarah Espinosa, Research Fellow at the London School of Hygiene and Tropical Medicine, Danielle Nierenberg, President and co-founder of Food Tank, and last but not least, Lopez, Brazil Director at Tilt Collective, and a recognized expert in healthy, sustainable, and equitable food systems. So I'm really excited to kick off the webinar. I am going to ask questions. And I think let's get started. Just to set the stage, I'm going to invite each of the panelists to answer this opening question. And I will pin you to the screen when you are speaking. So from your unique vantage point, how do you see the interconnectedness of our global food system, human health, and the health of our planet? What is the most pressing connection that we need to answer right now? And I will leave that open to whoever would like to go first. Or maybe I will direct the question to Dr. Shireen Kassam.
Okay, thanks everyone. It's great to be here with you. So not sure if I'm entirely answering this question, but from my medical perspective, addressing diet change and food system transformation provides us with so many solutions to our global health concerns, so much so that we should all be passionate about this topic because it includes the ability to improve health and well-being of individuals and communities, supporting planetary health, addressing the growing burden of antibiotic-resistant infections, and also reducing the risk of future pandemic infections. So there's such a broad array of benefits from addressing food system challenges.
Thank you so much. I will now call on Anna to give your perspective. Please tell us a little bit about yourself and also what you think, how you see the interconnectedness of food, health, and climate.
Hi, and greetings from Estonia. My perspective on this definitely comes from my experience as a medical student. As a future healthcare worker, I can see that the problem will be the next problem we will face. The climate change is not only about climate change, it's intergenerational and the problem is big, the problem is huge, and it's not all about climate, it's about healthcare as well. And over the past 2 years, I've worked with the civil society and also the Ministry for Climate, doing some actions on local level, but also engaging on global level. So attending COP28 and COP29 in Dubai and Baku. So the big conferences, we can see that the people are talking, but COP28 was actually the first one where like a proper health day was engaged in big climate negotiations. So I can see the change is already happening, but representing the youth voice here in this discussion, we need to talk about climate, which is also the biggest problem my generation is facing right now.
Thank you so much, Anna. And I'm looking forward to circling back to the topic of COP a little bit later in the discussion. And then to move on through our panelists, I will invite Dawn from A Well-Fed World. I'm excited to ask you to introduce yourself and tell us about how you see these intersections.
Hi, thank you so much. It's really wonderful to be here. I am Dawn Moncrief, and I'm the founder and president of A Well-Fed World, and we are a global hunger relief, food security, and climate advocacy organization advancing plant-based foods and farming to create a sustainable future for all. And I had been working on these issues to originally work at the World Bank on hunger issues, and then just realizing the impact of diet and the ways in which it was being neglected, ended up shifting my focus back in the late 90s. And so for me, and I think this is going to be big on the panel here, the most pressing issues is the ways in which the world worships meat and dairy consumption, and probably won't be as strongly worded by other panelists, but I'll go ahead and word it that strongly. I sometimes would even want to use the word addiction. I just would want to be very careful about that. But the way the world worships meat and dairy consumption and resist efforts to downsize personal and planetary consumption, despite broad expert acknowledgement of the immense climate consequences and other forms of environmental harm and destruction. A lot of times the favored solutions focus on improving processes and technology to reduce the harm on the production side, but not enough attention is being paid to reducing consumption, especially in heavy consuming areas, high consuming populations, high income populations. And that also many times when consumption is addressed, the focus will be on reducing consumption via population, which tends to have racial and gender biases, focusing on women in low income countries instead of reducing heavy consumption in wealthier or high income countries. So using animals for food should be the option of last resort and not considered privileged foods. And while reducing, minimizing, and ideally eliminating consumption of animal source foods will not be a panacea, it should be part of any viable food security or climate solution.
Thank you, Dawn. And on this World Environment Day, I think we really do have to have the courage to be strong in our statements, and so that we can really take action forward. So the next person who I'm going to invite is Dr. Sarah Espinosa. Please do introduce yourself while I pin you to the screen.
Thank you so much, Nanine, for the introduction, and thank you everyone for being here for this really important conversation. My name is Sarah, and I work at the London School of Hygiene and Tropical Medicine as a researcher. And for a very long time, I've been working on the linkages between health, nutrition, and the environment. And prior to LSHTM, I used to work at the Food and Agriculture Organization of the United Nations, where I used to also work on nutrition and food safety related issues and climate change. And I think the most important part of the conversation is that although we have so many different challenges across the food systems, I believe that because there's so many different entry points through the food system, we have a really huge opportunity to make a change in all these different areas. And I think the most pressing connection that we need to recognize is that dual benefit between healthy and sustainable diets, and how we just need to just recognize if we actually work towards this goal that is actually healthier for us, then is also healthier for the planet. So it's just like a win-win benefit for all of us. And we should just concentrate on that via consumption, but also production.
Thank you so much. And we're definitely looking for those win-win solutions, right? Where we can have the most impact across multiple sectors. So the next person who I will invite to introduce themselves is Danielle from Food Tank. I'm looking forward to hearing from you.
Hello, everyone. I'm Dani Nierenberg. I work with an organization called Food Tank. We're a research and advocacy organization really devoted to highlighting stories of hope and success in our food and agriculture systems. And we do this with the aim to inspire, motivate, and ultimately activate positive transformation in how we produce and consume food. My job is really about what we're talking about today, finding the connections and where those entry points are for the opportunities that we've already heard about to make the linkages between our planetary health and human health. I think I want to answer this question a little bit differently, though, because I think there's a lack of interconnectedness that we're not acknowledging. We always talk about breaking down silos, but we're not really doing it. And I think one of the panelists earlier said, people are talking, but they're not doing. And I feel like we need to really find a way that, health ministers are talking to climate ministers, where nutritionists are talking to farmers, where, all of these different sectors are coming together. I think we tend to go down an echo chamber, right? And talk to the people who only agree with us. And I think we have a lot to learn from the people who disagree with us. I'm sure many of us on this call share the same viewpoints. I would have loved to have people from different sectors join so that they, we can hear from them and they can hear from us. I think that kind of communication is a real opportunity that we are missing. And we have very little time to address that. And I think, the urgency of these problems is so great. We have to start getting out of our silos and getting, having those uncomfortable conversations that lead to unusual collaborations and partnerships.
Thank you, Dani. Definitely, it's time to get uncomfortable and move into the spaces that are outside of our comfort zone and really speaking up in new circles. So finally, I'm going to ask Marcos Lopez to share a little bit about where you're coming from, what you're working on, and also to answer where you see the most pressing challenges at the intersections of food, health, and climate.
Thank you very much, Nanine. First of all, I want to celebrate PAN International for this important initiative, and thank you for the opportunity to share the panel with such inspiring people. So I'm Marcos Lopez. I'm Tilt Collective Director for Brazil. Tilt is a philanthropy working to support a just transition to healthier, more sustainable, and diversified food systems. I believe it's still timely to celebrate initiatives that recognize this interconnectedness of food systems, human health, and planetary health. Until very recently, I would say there were just a few that would even consider this a relevant debate. But I think that it's also critical that we move beyond just viewing these interconnections only through the lens of health as a co-benefit of climate action, how climate impacts public health, or even how like health systems impact climate. It's critical to look for win-win solutions, but I think we need to go a bit beyond and start combining our expertise, our methodologies, and resources from like both sectors to better understand the shared and synergistic drivers of climate and global health crisis. And we must then join forces and combine forces to build like the governance, the policy, and the normative framework we need to address them systemically. So I'm really looking forward to unpack this in this panel, how we can join efforts to fight the common and shared synergistic drivers beyond just looking to the interconnections.
Thank you so much. And now that everybody is here, I can see we have many participants and everybody introducing themselves in the chat. You've all gotten to know our panelists today. So please feel free to drop your questions, direct them to the panelists. And I'm definitely going to keep my eye on the chat so that I can make sure that we answer your questions. And for now, we will stick to the questions that I have, and I'm very much looking forward to unpacking. So we're going to start with a bit of a focus on healthcare specifically, and I have a question for Dr. Kassam. From a clinical perspective, what are the most significant health burdens we're seeing today that are directly linked to our current dominant food system? And I'm really looking forward to you framing these public health crises that we're working on at the moment and that we're up against.
Yeah, so every country in the world, regardless of income, is really facing huge burden of non-communicable diseases, and they broadly, fit into a handful of categories that are very much driven by dietary risk factors. So globally, we all share rising problems with dealing with overweight and obesity. We have cardiovascular diseases, a broad category affecting our blood vessels, our heart, and the rest of the cardiovascular system. Type 2 diabetes, which is often linked with carrying excess weight, but not always. And then more recently, dementias, particularly Alzheimer's dementia, is also catching up, being a problem that affects older people, but is affecting more and more people. And when you look back at what the predominant risk factors are that are driving these conditions, diet is right up there. We know from a lot of scientific evidence that dietary risk factors are a key component of the development of these conditions. And these risk factors are down to the fact that we're over-consuming, ultra-processed foods, meat and dairy, but also because that is shifting out from the diet the foods that we know promote good health and protect us from getting chronic conditions. So we're just not meeting our goals for eating the healthy foods, which are essentially fruits, vegetables, whole grains, beans, nuts and seeds. And as has already been mentioned, what we know is healthy for us as humans is also going to be the right approach for dealing with our climate and nature concerns and meeting our climate and nature goals. So we've got a really great opportunity to address this and address public health globally by shifting away from animal source foods, industrialized food system, back to the basics of a healthy plant-based diet.
So there you have it, folks. You've heard it from the doctor, a medical doctor herself, framing the challenges that we have and some already introducing some of the solutions. And I really can't stress just what a massive challenge chronic non-communicable diseases are, whether you're a medical professional, that sees these types of patients, or whether you experience this in the lives of your family and friends. There's so many people who are living with cardiovascular disease, hypertension, type 2 diabetes, overweight, and all of the metabolic conditions that come with that. And the worst part is that they are completely preventable, and the best part is that they are reversible. So these are really the relevant conditions that we're talking about. And now I'll speak to our future doctor on the panelist, Anna. As a medical student and youth advocate, how do you perceive the future health implications for your generation if we continue with business as usual?
Thank you for the question, and also taking from Dr. Shireen. We also did a little campaign with the doctors, a collaboration between doctors and medical students in Estonia for the World Obesity Day a few months ago. And we campaigned for sustainable, healthy diets, addressing obesity. And a very practical example from that would be that we approached one of the biggest fast food chains in Estonia, one of the most well-known brands, and they declined to take part, politely but firmly. And that was a reminder for us that awareness is not enough. We volunteered for the action, but they didn't just come true because they already had all the communication plans made ahead of time 2 years ago. And they're not just like they are basically very strict with their communication plans. So my message would be that we as young doctors and future doctors need to courage, not only from policymakers and professionals, but also from these big corporations and industries, to confront the uncomfortable truths. So, because the loudest voice in the room belongs to the ones who have the money, we as doctors don't have the time and capacity to deal with the big firms and companies. But as a young medical student, I still have the time, but I think in a 5 years' time, when I'm working as a resident, I just don't have the time to deal with the topics so much that I'm happy with it. So the biggest concern for the medical students and future doctors is how to address the real dealers in the room, the big voices. And that's why I joined as a climate youth delegate as well, just to see how the global network works every day and how can we take those approaches and bring to medicine as well in terms of advocacy and how to make the change. So I'm looking forward to any cool ideas I can get from our panelists today, how to encourage people and make the difference.
Thank you so much for sharing your story. We also had a campaign for World Obesity Day. I think it's very, very important to go up against industry influence and continue to question where narratives are coming from and whether they're coming from industry or whether they're coming from trusted health professionals who truly are the experts. And I'd like to ask Dawn, for your perspective, how, in your experience, does this crisis disproportionately impact vulnerable populations, these health crises we're talking about? And how does it exacerbate existing inequities, particularly in the global south?
Well, animals eat much more food than they produce. This isn't debated, and that's including protein. They eat much more protein than they produce. The only degree that's debated is how much more food, how inefficient are animals in producing food. So even within the plant-based communities, the degree of waste is often underestimated. And since we have a few minutes, I'm just going to give 2 brief examples to really try to bring this home a little bit. At the most inefficient, we would look at beef cattle. And the meat industry will tout a 7-to-1 feed conversion ratio. And so what that means is that cows have to eat 7 pounds of crops. Again, this is not just grass or areas that are not otherwise arable. That's going to be corn and soy, wheat, edible crops. This is not just a protein trade up. 7 pounds of crops to create 1 pound of beef. This is the meat industry. The plant-based communities for a long time have used a 16-to-1 ratio, but researcher Vaclav Smil, who is not plant-based, uses 25-to-1. And what this is it's the difference between a live animal and then the edible weight. So after you've butchered the animal and you've taken out the bones and the blood and all the parts that aren't edible, the pieces that actually make it to the consumer is much smaller. So you lose half to 2/3 of the animal's weight. And that's why you would get a 25-to-1 ratio. And I know a lot of people don't deal in these types of numbers. So I just have a really easy way to picture what this means with a 25-to-1 ratio. Is that if somebody is eating a 100-calorie burger, so that's not even very thin, it's just a thin burger, 100-calorie beef patty, that would take 2,500 global crop calories to create that 100-calorie beef patty. So that is enough to feed an entire adult for an entire day, even more than enough. 2,000 is the baseline, right? So 2,500 just from that one little beef patty. And that's the ways in which meat consumption can be a form of redistribution and waste, is that it's competing with the world's poor to make those calories available to the wealthier communities. At the lower end, if you think of chicken are heralded as highly efficient, and compared to cows, certainly they are. And you'll see a 2-to-1 ratio by the meat industry in terms of what they, and sometimes a little bit lower, but again, that is actually more like 4 times. But even if you use the meat industry's numbers of 2-to-1, that's a 50% waste. We're concerned about global food waste being 1/3 to 40%, and we absolutely should be concerned about global food waste. But this is just a way in which even the most efficient meat is a form of food waste. And I'd like to really bring that in as an example, because that's resources that are being used for the world's poor. That's also energy consumption, water consumption. And then, of course, meat and dairy are climate multipliers. And it's widely understood that climate destruction is most heavily impacts those who are contributing the least in terms of greenhouse gas emissions. So areas along the coast and the equator are most heavily impacted. Africa in particular is the most food insecure continent, the least meat and dairy consuming, and the most climate impacted continent. And so that's one of the ways. And then always when there's a food scarcity, women and girls are deprioritized and receive less.